First, joining us this morning is Congressman Jimmy Gomez, Democrat of California, member of the Ways and Means Committee, represents the 34th District in California. Congressman, I want to begin with the upper chamber in Congress, the Senate. And the headline today in the Wall Street Journal, Senate considers plan to end shutdown. Senate Majority Leader John Thune expected to bring to the floor the 15th vote on the House-passed continuing resolution. According to news reports, it will include extending current funding until either December or January, and possibly 3 appropriations bills that would deal with SNAP benefits, paying congressional staff and Capitol Police, as well as the military and Veterans Affairs. Would you advise your Democratic colleagues to vote on this test vote, yes, to open up the government?
I would advise my Democratic colleagues, but also my Republican colleagues, to start acting like legislators, to start acting that they were duly elected in their own right to represent their states in the U.S. Senate, and not to just do whatever Donald Trump wants. I would advise them to, if they don't believe it's a good deal, vote no, get together, work out a deal that they think that they can all live by, and go from there. Because the reason why this isn't working right now, why Congress isn't working, is because the Republicans have given up all their power to Donald Trump. That's both in the House and in the Senate. And legislatures and bodies, deliberative bodies like the Senate and the House don't work that way. It's never going to work that way. So the only way that they can get out of this mess is if they actually sit down together and talk. But it started since last year when we had a budget deal across the aisle, bipartisan, both chambers. People tend to forget that there was a deal on a budget. And what ended up happening is Donald Trump and Elon Musk at the time said, blow up the deal, blow up the deal. So how are people supposed to negotiate if they can't trust that that deal is going to stick? Right. And then at the same time, how are we not supposed to, how are they supposed to negotiate if Donald Trump doesn't even spend the money that Congress appropriates? So that's what I would say. If they don't think it's a fair deal, don't vote for it. Sit down in a room and work out a deal that you can support.
Are you in agreement with the Democratic strategy that they will not vote to open up the federal government until Republicans talk to them about making permanent these enhanced tax credits for the Affordable Care Act?
Yes. And the reason why is that one of the main issues that Americans are facing across the country is the increase in cost of living. It's becoming more and more less affordable here in the United States. No matter where you live, groceries are up, cars are up, baby shoes are up, cribs are up, and it's struggling. So if you actually pay your grocery bills like I do, I go to the grocery store every week. I feel the pain in the wallet. I see my savings go down, down, and down. So Americans can't take another hit, especially when it comes to healthcare, where they're going to see their premiums increase on average 114%, hundreds of dollars a month and $1,000 a year. And what happens is if that happens, they either have to decide, can I afford it, or do I just take the risk of getting sick and not having health insurance and go into the ER? And that's what you're going to see. So this is not just about American families in blue states. It's also about American families in red states. We see that the folks in red states that never expanded Medicaid are going to be disproportionately impacted by this. That's why even Marjorie Taylor Greene says we have to have a plan to deal with this issue.
How is that a plan, though, to lower the costs of health insurance if the government makes permanent enhanced tax credits for the Affordable Care Act? What incentives do insurance companies have to lower the cost of health care?
Well, first, you have to deal with the fact that the American people are going to be paying out of pocket. And if you don't think it's going to actually, let's say it's like a prevent spikes from occurring. And the reason why is because you have to have enough people in the risk pool, enough people who are actually getting health insurance that are healthy, that are not going to be have high acuity when it comes to their health issues. In a situation where it's too expensive, people drop off. And if they drop off, what does it mean? It's often health insurance risk pools are only left with people who are older and who are sicker. It's just a matter of fact, as you get older, you get more ailments, and that means that you're going to have to get more care. So having healthy people keeps the prices lower. And is it perfect? Absolutely not. But we also have to look at the twin goals: affordability, 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 and then also accessibility, accessibility, accessibility. 98% of Californians were covered up until recently. 98%. The 2% that were covered were undocumented immigrants. So we can do it, but we have to take steps. And at the same time, people have to acknowledge that Donald Trump and the Republicans have been slowly chipping away at the ACA and making it less stable. And one of the things we want to do, if you want to have a conversation about lowering total cost, we should do that. Individual cost, we should do that. But right now, their plan is just to let the prices go out of control.
Congressman, before we let you go, Washington Post headline this morning: House Democrats request interview with former Prince Andrew on Jeffrey Epstein. What was this request, and has it been granted by the House Oversight Committee?
I'm not sure if it's been granted yet by the House Oversight Committee. I went on the BBC earlier in the week, right after the story broke about King Charles taking away the rights or the privileges from Prince Andrew and basically just making him another citizen of the United Kingdom. I said we should pull him, ask him to come to Congress and testify to find out what he knows and who he knows was involved in the situation with Jeffrey Epstein. I think this would be a momentous occasion. It would actually say that the elite, no matter where they live in the United States or the United Kingdom or across the globe, are not free from accountability. So I'm looking forward to hearing what he has to say and if the request is actually granted by the majority.
Congressman Jimmy Gomez, Democrat of California, we thank you for a very early morning conversation for you. Thank you very much.